All right, new at 6 now. Doing drugs. Turns out Rhode Island tops the nation in drug use.
That includes marijuana and other drugs. And tonight we're digging deeper into a national survey. Allison Bologna is here with that. Allison?
Patrice and Jean, the statistics are sobering. Rhode Island ranking #1 despite so many social services becoming more available for those struggling with drug and alcohol addiction.
Rhode Island has a problem. The highest rates of marijuana and illicit drug use in the country.
It's a terrible statistic, and I hope that will spur the new administration on to really seeing how much resource we need sunk into this.
The report is a national survey on drug use and health sponsored by the Substance Abuse and Mental Health Services Administration. And it comes at a time when Rhode Island is trying to lead the nation in services for those struggling with addiction. The Anchor Recovery Centers in Pawtucket and Warwick combined see more than 6,000 visitors a month. The Providence Center is helping to bring a program into the ACI where, while incarcerated, inmates can work to become certified recovery coaches on their way out. All of that is good, but there's a big concern now for those using drugs at a young age.
Our biggest problem is the 18 to 25-year-old group. And unfortunately, Rhode Island and many other states in the country have seen an increase in use actually over the past year or two.
Part of this has occurred, we're told, as medical marijuana and legalization issues have taken hold. At the YMCA in Warwick, they've partnered with the Anchor Recovery Center to help provide wellness programs for men and women in recovery in the hopes that they can help curb the statistics.
You know, we don't want to be ranked highest in the state for these kinds of things. We want to be ranked highest in the state for having support systems, and we want to minimize this.
Jim Gillen from the Anchor Recovery Center says there are now more resources than there ever have been before.
But obviously it's not enough.
The statistics you can find online. To keep them out of jails and hospitals, Jim's saying he doesn't want to see more of that happening, so treatment is a priority. In Massachusetts, the numbers were, of course, not as high as here in Rhode Island, but still the Northeast showed high rates of use overall, whereas the South had the lowest numbers. Allison Bologna, NBC 10 News.